Today, let us discuss about metronidazole. Metronidazole is a nitroimidazole antimicrobial. In generic, it is available as metronidazole. In brand, it is generally available in Flazyl or Flazyl ER. Flazyl ER means extended release. Mechanism of action. It generally diffuses into the organism and inhibit the protein synthesis by interacting it by interacting with DNA and cause the loss of helical DNA structure. Finally, lead to the cell death. Anaerobic protozoal parasite possess the enzyme pyruvate paradoxine oxidoreductase. This is generally not found in the mammalian cells. This enzyme is involved in the production and energy production and other metabolic function through electron transfer reaction. Generally, metronidazole contains nitroimidazole structure. This nitroimidazole structure serves as an electron acceptor, and this in turn gets reduced. This reduced metronidazole is cytotoxic to the anaerobic bacteria. This results in the replication, transcription, and repair process of DNA, and finally leads to the cell death due to DNA fragmentation. This is how the metronidazole acts on the bacteria and finally lead to the cell death. This is this reaction is not found in the mammalian cell. It is generally used in most of the bacterial infections like bacterial vaginosis, pelvic inflammatory diseases, endocarditis, dracunculitis, giarditis, trichomonasis, amoebiasis. In some cases, due to irrational use and reduced uptake of drug and increased removal from the bacterial cell, this result in the resistance. Some of the conditions are due to anaerobes and due to Helicobacter pylori, and due to susceptibility it may causes the resistance of the drug. It generally available in three forms: capsule, tablet, and injection. In capsule form, it is available in 375 mg. In tablet, it is available in 200, 250, 400, 500 mg. In case of extended release, it is available in 750 mg. In case of injection IV infusion, it is available in 500 mg per 100 milliliter. Some of the conditions and doses. Amoebiasis. In amoebiasis condition, the dose is 500 mg or 750 mg orally. It is taken 3 times per day for 5 to 10 days. In case of giarditis, 500 mg orally 12 hours for 5 to 7 days. In Gardnerella infection, in case of immediate release, it is taken 500 mg orally 12 hours. In case of extended release, 750 mg orally for 7 days. It should be taken on empty stomach. In case of Helicobacter pylori infection, it is taken in 250 to 500 mg, which is taken orally 4 times a day in combination with tetracycline or bismuth salicylate for 14 days. In case of non-gonococcal urethritis, it is taken 2 grams orally single dose with erythromycin for 7 days. In case of pelvic inflammatory diseases, it is taken 500 mg orally every 12 hours for 14 days in combination with ofloxacin or levofloxacin. In case of sexually transmitted diseases, 2 grams as a single oral dose. It is taken in combination with 3 drugs like ceftriaxone or cefixime or plus azithromycin or doxycycline. In case of bacterial vaginosis, in case of non-pregnant women, it is taken 500 mg 2 times for 7 days, 2 grams orally once per day single dose. In case of extended release, 750 mg orally once per day for 7 days. In case of pregnant women, it is taken 500 mg orally twice daily for 7 days or 250 mg orally 3 times. In case of colorectal surgical infection, metronidazole generally used as a prophylaxis 1 gram orally every 6 to 8 hours for 3 doses. After that, it is taken 15 mg per kg IV infusion for 30 to 60 minutes completely, approximately 1 hour before surgery. May administer 7.5 mg per kg IV for 30 to 60 minutes at 6 to 12 hours after initial dose for maintenance dose. After 12 hours, this metronidazole drug is discontinued after the surgery. In case of trichomonasis, 250 mg orally every 8 hours for 7 days, or alternately it is used as 375 mg capsule orally every 12 hours for 7 days. 2 grams orally once daily single dose alternately. 1 gram orally every 12 hours for 2 doses. In case of IV infusion, 2 doses are maintained. Loading dose. It is given 50 mg per kg IV and it should not exceed 4 grams per day. And for maintenance dose, it is given 7.5 kg per oral intrafusion every 6 hours for 7 to 10 days. Side effects of metronidazole generally experienced in some patients, like epigastric distress, seizures and metallic taste, darkening of urine, peripheral neuropathy, pancreatitis, hepatitis, fever, reversible neutropenia. It is generally contraindicated in some conditions like hypersensitivity, psychotic reaction with disulfiram. In case of alcoholic people, it may develop disulfiram-like reactions, and in cocaine syndrome also. This drug generally interacts with some drugs and potentiate the side effects. Some of the drugs which results in adverse side effects such as metronidazole generally increases the anticoagulant effect of warfarin and lithium toxicity by decreasing its elimination, and increases risk of neurological effect with cimetidine.